we're talking about the COVID vaccine today. It's a hot topic in the news with the vaccine rollouts of the various companies. And I think patients planning a pregnancy have special concerns about it. First of all, we know that not taking the vaccine has a risk of getting COVID, and that pregnant women get more severe symptoms and more severe morbidity with COVID than non-pregnant women. In other words, getting COVID once you're pregnant would have a greater risk to your health. And that finally, the virus can be transmitted if you're pregnant with it to the baby, so it puts your baby at risk as well. So clearly not getting COVID in pregnancy would be the best, and the only way to mitigate that with high degree of success would be to get the vaccine. So we certainly recommend all women get the vaccine before conceiving if they can. Of course, its availability is a limiter, and unfortunately young and healthy women are sometimes lower on the priority list to get the vaccine. But if all of you out there find that it becomes available to you and you can get the vaccine before getting pregnant, before having an embryo transfer or an insemination, whatever the case may be, I think without question that's your safest path. There has been a rumor that the vaccine could cause contraception, that it could block pregnancy by interfering with the placental protein that's necessary during early pregnancy formation. And this simply is not true. There is no data that the vaccine lowers fertility rates. And in fact, that was looked at in the vaccine trials, and women who were trying to conceive had the same rate of fertility whether they were in the placebo group, which did not get the vaccine, or they were in the vaccinated group. If you find you're already pregnant before the vaccine's available to you, you'll want to discuss that with your OB. There's no evidence that taking the vaccine while you're pregnant is harmful, but there's also not a lot of data, because unfortunately pregnant women weren't included in the 2 vaccine trials that we know about. And so more data needs to be generated on giving the vaccine during pregnancy and any effects it might have on the mother or the baby. And time you're in a position to get the vaccine and are pregnant, hopefully that data will exist, but you'd want to talk to your OB at that time about whether the vaccine should be given during pregnancy or wait till delivery. As far as breastfeeding goes, the vaccine does not harm a breastfeeding baby, but indeed the antibodies generated from the vaccine into your bloodstream could cross over to the breast milk and actually be protective for your baby. So in summary, if you're not yet pregnant, get the vaccine. If you're already delivered and breastfeeding, get the vaccine. And if you're pregnant, when the vaccine becomes available, ask your obstetrician about the benefits and risks. Thanks.